This is MC D8 skin analysis device, and this is the PC model and our latest release, which was debuted on 27 February. So this device, it has two languages, which is English and Mandarin currently. And apart from that, you can be able to add some some details in the settings, like the consultation doctor's name, the clinic's name, and some other details like the logo and the banners, which would appear on the analysis report. And also, you can be able to add some watermarks. And apart from that, you can see on the homepage, you have the history, you have the add new client, and you also have the data center. So normally when you have a new patient, you need to first create a profile for the patient. So normally when you have a new patient, you need to create a profile for the patient. And after that, you can proceed to shooting mode. And during shooting mode, you have three options. You have for aesthetics, you have for skin analysis, and you also have for skin analysis and aesthetics combined. So you can choose from either of these options. So today we're going to try the aesthetics and the skin analysis. So the capture mode takes roughly about 2 to 3 minutes. And during this period, the device captures the whole face at one time. You do not need the patient to move around to take the pictures. And after taking the pictures, the AI would create a 3D model of the face. So during capture, we have the neck flap, which you have to use to cover the neck of the patient. So basically, we use this to avoid the reflection of the clothes to the camera. So if the patient is wearing a bright clothes, you need to use this to cover the patient's neck, just like this. And also we have the hair flap. This is for patients with long hair. You can use this to prevent the hair from flipping in front of the face. And for the aesthetics capture, you need to remove this and proceed to capture. So they need to put the forehead on the base, and then you can cover with this. And you need to make sure that the patient is in alignment according to the screen. So now the AI is going to start the capture mode. And after capture mode, you have an option to check the pictures and see if some of them are blurry. And if none of them is blurry, you can proceed to analysis and then take for the aesthetics. And if there is any blurry image, you can retake the pictures and then try it again. So like I said earlier, the capture mode takes around 1 to 2 minutes for the whole analysis. So this is because the AI takes time to create a 3D model of the face. So it's not as quick as the other skin analysis devices we have, which of course doesn't have the 3D. So after the capture mode, you can be able to check the images and see if there is any blurry image. And since there is no blurry image, you can proceed to the aesthetics. And for the aesthetics, you need to put this back into the device. So now the AI is modeling the face based on the picture that it already took. And here you can see it takes different degrees of the face because it has a mirror inside the device, which allows it to take the picture of the whole face at one time. So you don't really need to move around to take the pictures one by one. So it takes the whole face at one time. So now we're going to take the picture for the aesthetics. So for the aesthetics, you need to make sure that the patient is closing his or her eyes. Unlike the first one we took, they need to keep the eyes open and focused on the camera. But for this aesthetics skin analysis, they need to close the eyes and before you proceed to take the picture, because for this particular capture, it uses the UV light, so they need to close the eyes to avoid causing damage to the eyes. So same like the first capture that we did, it also takes a little bit time, but more fast than the first time, because the AI already took this picture before, just a different dimension, so it's a little bit more fast than the first time. For this skin analysis, it's going to take four basic pictures, which is the RGB, the CPL, PPL, and the UV light. And then after analysis, it's going to give more image spectrums. So these other image spectrums are going to come from these four basic images. And the reason is because the device has a very high accuracy and precision. So this means it doesn't need to take so much images like the iPad skin analysis devices that we have. So right now you can be able to check the pictures, and if there is no blurry image, you can be able to proceed analysis. So now the AI is going to create a 3D model of the face, and then after that you can be able to access the analysis report. So this process normally takes about 30 seconds to 1 minute. So after creating the 3D model, then you can be able to access the analysis report. So this is what it looks like after the AI finished creating the 3D model of the face, and this is the RGB light. So like I told you earlier, after analysis, it's going to give you more pictures. So here you have the RGB, you have the code, you have the PPL, the CPL, you have the redness, the red areas, the red heat, brown heat, UV spots, and the UV. So this is the RGB light. So the RGB light is the same as the normal day sunlight, and this is basically what you can see when you look at the patient's face. And the next is the code. So the code, the AI abstracts the lightening on the face so that you can be able to have a more clearer view on the texture of the skin. So here you can be able to see the acne, the pigmentations on the face. And here also you can see the pigmentations. So the next is the parallel polarized light. So here the AI adds a little bit lightening to the skin, so you can be able to have a clearer view of the skin texture. So from here you can also see some skin problems such as the spider veins. And here you have the crossed polarized light. So here the AI adds more lightening to the skin so that you can be able to see the skin more clearly. And the next is the redness. So here from the redness, you can be able to check the sensitivity, the inflammations on the skin. So you can see here the red areas are the areas of the skin which are very sensitive or which has inflammation. So from here it's very easy to detect, and you do not have to mind the lips, because normally the lips is always wet, and normally it's going to show as inflamed area. So the next is the red area. So for the red area, the AI shows the face in a different graph. And here you can see that some areas are more reddish than the other areas. For example, this area and this area. So it pinpoints the areas of the origin of the inflammations on the face. So from here you can see more clearly where the face has inflammation. So here you can see some areas are more reddish than the other areas. And the next is the red heat. So the red heat on the here, you can see the face is in four colors. It has the red, the yellow, the green, and the blue. So the red areas it either has inflammation or pigmentation, and the yellow areas are the surroundings of the red areas, and then you have the green and the blue areas, which are the mild sensitive and also the normal skin. And the next is the brown. So the brown mostly is used to check the pigmentation of the face, and also you can use it to check the melanin distribution on the face. So with these spectrums, you can be able to get a lot of details about the skin. So from here, you can see the spots, you can see the inflammations and the pigmentations, and you can also see the melanin distribution. So here you can see that this area has more melanin than this area. So same as here, you can see. Also, it can be used to check the dark eyes. So if your patient has dark eye, you can also be able to see it from here. And the next is the brown heat. So the brown heat, it also has four colors, which is the red, yellow, green, and blue. So the red areas are the areas with the pigmentations or inflammations, and then the yellow areas are the surroundings, and then the blue and the green areas are the mild and also the healthy skin. And the next is the UV spots. So from the UV spots, the AI shows you the skin in a black and white mode, and from here you can see the UV spots, which are the spots that are not yet visible to the naked eyes, and also you can see some pufferings from this filter. So here you can see the fatty deposits in the skin pores, which in a few moments is going to become skin problems such as acne or inflammation, pigmentation. So here you can see that this patient needs to clear the skin pores. So you can be able to see clogged skin pores from here. And the next is the UV. So here from the UV, you can also see these fatty deposits more clearly. And from here, you can see the yellow and red dots. So these are the fatty deposits that are inside the skin pores. And here you have the shadow. So with the shadow, you can be able to access a particular area of the skin using this as a lightning or like a torch. So here you can be able to have a clearer view. And the next is the gray. So with the gray, it shows the skin like this, and you can be able to check the smoothness of the skin. And for example, if the patient has wrinkles or folded skin, you can easily detect it using this. And here is the comparison function. So with this, you can be able to keep track of your patient's treatment, and you can see the development and improvement of the skin. And here you can be able to compare the analysis that they have done before. So you can be able to check the present situation of the skin and the previous situation. So here you can see you have the date and the time of the capture and the analysis. And you can easily click here to select which date you would like to compare with each date. And then you can easily compare both pictures and analysis. And here also you can decide to choose that the analysis should be left and right instead of up and down. And also you can be able to select the mirror. So here on the down right corner, you have the more, which you can be able to use to check at least 4 pictures and 4 analysis from different dates. So here you can be able to compare the analysis and see if there are improvements. So here you have the symptoms And for the symptoms, you can be able to click here, and you can see the areas of the skin. So here are the surface of the skin, the spots on the skin surface. So here the AI is going to circle the spots in the blue lines, and here also you have the show. Here you have the show, and the show is going to give a score and also give you an area ratio, and also it's going to tell you the quantity of the spots that the AI already circled. And the next is for the brown. So for the brown, it also does the same. It's going to show you the symptoms, the causes, and also you can select the key advice from here, or you can unfold it. You can fold it or unfold it. And the next is the UV. So for the UV, also it's going to tell you the quantity, and they tell you the area ratio, and they give the score to the skin. So basically, you can check the score and of the present skin condition, and check the score of the previous skin condition to quickly see if there is an improvement or if there are changes. And here is the sensitivity. So for the sensitivity, it also does the same. It gives a score, an area ratio, and also the quantity. And this is for the pores. So this is for the pufferings, and like I said earlier, the yellow and the reddish dots on the skin is the fatty deposit in the skin dermis, and the next is for the big pores. So here the AI is going to circle which areas of the skin has large skin pores. So this is the pores, and this is the big pores. So here the AI is going to circle the areas of the skin that has the large skin pores, and here is also going to give you the score. It has the small, the large, and the medium sizes. So you can see the red is the large pores, the yellow is the medium, and the green is the small skin pores. So it's all going to give you a number of it here, and they also tell you the area ratio, and it's also going to give you a score as well. So the next is the aging analysis, and here you can see it's just like checking for the wrinkles. So here you can see the wrinkles of the crows, and here you can see the score and the area ratio. And the next is for the forehead. And the frown, the bunny lines, the marionette lines, the nasolabial folds, and also the tears. So the next is the aesthetics analysis. So from the aesthetics analysis, you can be able to see the upper thirds, the middle thirds, and the lower thirds. So here you can basically see the distance, and then you can see if the measurement is accurate or not. And here you have the horizontal fifths, and also you can be able to check, you can be able to move the lines. So you only need to right click and hold, then you can move the lines. And for this one, right click and hold, move the line. Same with this, right click and hold, and you can move the line. So here you can see the distance of the vertical fifth, and here also you can see the proportion. So this detail is very important for the aesthetic doctors for their surgery. And next is the symmetry. So the symmetry is also it's also the distance of the sizes of the face. So here you can see the left and the right, and you can also see the proportions. And here you have the golden angle. So for the golden angle, you can be able to see the angle of the face. So here it gives you the angle, which is 60 to 70% degrees, and here you can see it's 75.22 degrees. And here you have the nose angles. So here also you can see the proportions of the nasofrontal angles, the nasofacial angles, the nasal tip angle, and also the nasolabial angle. And the next is the E line. And then after that, we have the aesthetic design. So here, the aesthetic design, you can be able to design how you would like for example, you can design how the patient would like to look like, and the patient can be able to approve that the look before they start the surgery or before they start to add the fillers. So this helps to build a good trust between the patient and the doctor. And also you can compare the result with the design and see if it's already completed or if you need to add more fillers. So here you have the adjustment, the free adjustment. So here you can be able to adjust which area you want by right-clicking. Right-click and hold, and then you can move it. Right-click and hold, and you can move it. And also here you can reduce the radius. Here also you can reduce the intensity. So for example, like this. And here also. And then here you can easily click here, and then you can see that the red areas are the extra fillers that you need to add, and the green is the distance between the normal skin and the fillers that you need to add. And here also you can click it and you can easily see it. And apart from this, you can easily click and hold here for easily before and after comparison. So here you can be able to measure the volumes. So this is the distance. You right click. So you can see the distance, and also here. So this is the distance also from here to here. So you can easily see. And also this is the angle. So from here you can also easily check the angle, and also this is the volume. So this is how many ml of the fillers that you need to add to this area. And also here. And this is the comparison. This is the comparison function. Here you have the overlap, and you have the comparison of 4 images. Here also you have the comparison of 2 images. So back to the aesthetics and the analysis. So this is basically all that you can be able to access from the analysis. And here you have the analysis report. And here you have the symptoms, you have the labeled. So the labeled, you can be able to add it by yourself. And these are just defaults, and you can be able to add the labels in your own language. So here you have the narrative contents, and here you can be able to select your plan. Here you have the diagnosis. So this is the analysis report, and like I mentioned earlier, you can be able to add your clinic's banner here, and you can add the name of the doctor and your clinic's name and address and telephone. This is to enable the patients to easily get in touch with the clinic. And here you have the image spectrums, and here you have the narrative content, the diagnosis recommendations, the labeled and also selected plan. And here also you can add more details about your clinic. And here you can be able to click to print it, or you can generate the PDF. And here you can easily click here to scan the QR code and get the analysis report on the mobile phone. So this is pretty much the tools that you can be able to use in this 3D analysis. And as you know, we add more features to our softwares every 1 to 3 months. And also, after you get the device, we can arrange an online training and teach you how to use the device. And also, if you need training, face-to-face training, we can also arrange it and discuss the details. And apart from that, we can give you online training and also send you some tutorial videos. And we also have these videos on our YouTube and also on our social medias like Facebook, Instagram, and LinkedIn. So thank you for watching this video, and feel free to contact us if you have more questions. Thank you very much, and have a great day.